Hello and the warmest welcome to this edition of Captains of Industry. When I say Lord Edmund Nigel Ramsay Crisp, it sounds like the name of an aristocrat from a bygone era. This couldn't be further from the truth though. Lord Nigel is a member of the House of Lords, but he earned his peerage after a stellar career in public service. He's credited with turning around Britain's public healthcare system, and more importantly, he's raised awareness about the pitfalls of public healthcare in the developing world, always looking for synergies between richer nations and poorer countries. The former head of the National Health Service of the United Kingdom and now an independent member of the House of Lords, he continues to work as a consultant in the healthcare industry. And Lord Nigel is our Captain of Industry tonight. Thanks so much for being with us. Welcome to South Africa. Whenever I have esteemed guests from Britain, I'm never sure, is it Sir, is it Lord? What does all of this mean?
Well, I think lots of Brits would ask the same question. So I hope you'll call me Nigel, but I am a knight, so I was actually originally Sir Nigel, and that was part of our British honours system.
Right.
But now that I'm a Lord, the point about being a Lord is that you're a member of the House of Lords, which is sort of like being a senator in many other countries, you would call it that. So it's part of the legislature. But we have a very odd House of Lords because there are about 25% of us are independent. We're not members of political parties. We're there because of our expertise. So in some ways I think of it a bit like an African House of Elders. You know, there's a few bit from each parts of our tribes. You know, there's architects and artists, there's authors, there's doctors, there's nurses. And what we do is we're probably in the House of Lords about half the time, but the rest of the time we're doing whatever it is we're doing. And you bring that expertise back to the House of Lords, so that when we're looking at legislation, we bring some real life to it, you know? We're talking about healthcare, and I've got 10 doctor colleagues in the Lords.
Okay, so when you're not sitting in the House of Lords and you're a consultant, what is it that you do day to day?
Well, what I do is, this is going to sound very, very silly, but I've reached a point in life where I only do things I want to do with people I like.
Lucky you.
Isn't that good? And there's quite a lot of both of them. And I do about 8 or 9 things. About 3 or 4 of them pay me. And so I do some paid consultancy for companies who I think are doing interesting things and who want my expertise. And I do that 5 or 6 other things which are voluntary or charitable, working with NGOs in Africa. A lot of time in Africa, actually.
Still focused on healthcare?
Almost all healthcare. Healthcare and design, actually. I'm very interested in design, so I've ended up doing some on architecture.
I mean, obviously, a peerage is the ultimate commendation, as you're saying, and former Prime Minister Tony Blair praised you publicly for the work that you'd done with the NHS, felt that a lot of the reforms, a lot of the efficiencies were due to your interventions. Now, you've worked extensively in Britain's public healthcare system. Give me the most fundamental lessons you learned.
Well, I think there are a lot of them, but probably starting from the beginning is healthcare. There are so many stakeholders. There's doctors, there's nurses, there's us as patients, there's industry and so on. And that actually, to make change, people have got to be moving in the same direction. So there's a big message here about public and private working together, which we might come back to. So there's a bit about, you know, you're a leader, but you're a leader of a coalition of leaders. You know, this isn't a one-man band or a one-woman band. I think a second thing is, you've got to make it accountable and measurable. Healthcare covers everything, you know? So you've got to have some priorities. And the danger is with the public system, you can sort of make it feel as if it's woolly and wishy-washy. So we had to choose some priorities, and we had to drive those hard. But when you make changes in some areas, it will often have a knock-on effect in others. And that was another really important point.
Help me understand how the system works, because you say you've had to find synergies between the public and the private elements of healthcare. Now, many people, certainly in this country, we always hold up the NHS as a wonderful example of efficiency and how the government can work with the private sector to provide basic healthcare. But others say NHS is an exercise in socialism. It's taxing the rich to provide a basic social good, which is healthcare, and making sure that everybody can access it. But it comes with a huge constituency taking a big brunt of that cost.
Well, yeah, very interesting point this, because think of it in a way as a great national insurance system. You know, actually, we're all paying in our taxes, all of us, rich and poor, if we're paying taxes, and that's what's used to provide most of the healthcare. 90% of healthcare in the UK is funded through taxes. The other 10%, people may have private insurance of some sort, which will tend to be add-ons. It will tend to be, you know, much more comfortable rooms. It will tend to be surgery on weekends when you want it. It will tend to be, you know, the things you might want to pay for, a bit more privacy and all of those sort of things. And the argument that we have, and it's true of Europe, it's not just the UK, we have slightly different versions in Europe, but there's a social solidarity that we're in this together, and that actually is a mark of a civilized country, that people are healthy. But it's very cultural. So the American system is completely different. There's a cultural expectation that you look after yourself. And the result of that is the poor don't do so well. But that's the sort of background that we come from. But the big change we made is we said, okay, it's going to be tax funded, but it doesn't have to be provided by the public sector. Yeah? Up until the end of the last century, basically we collected the money from the taxpayer and then we spent it in NHS hospitals with state employees. What we do now is we collect the money from the taxman, and we still have NHS people deciding how it's spent because they're the experts, but some of the services are bought in from private hospitals and from private companies, including some South African ones.
I want to continue on this track because we're beginning to have a brewing debate here about a possible national health insurance. And private medical providers are concerned because apparently private medical aids don't work very well. So there's the element of fleecing the system and needing to introduce better governance. Then there's the question of the basic social good, the democratic ethic that all people need to have access to healthcare. It is a human right. Then there's the question of financing it, and when less than 10% of the population constitute the tax base, this becomes a really emotive issue because there is a sense that the rich are really subsidizing the poor and the government is failing in its deliverables because no sane person would go to a public hospital, for instance.
Well, I don't know your system well enough, but I've met in these last 2 or 3 days some great people here. Some great people working in the public sector as well as the private sector. You've got some terrific people. So I wouldn't write off your public system in quite the way that you're talking about. But I've no doubt that it was like ours. It needed improvement, and we had this system of public sector needing improvement. The private sector was doing some good stuff. So how could we get from the private sector some of the things that would help improve the public sector? Because I do think that worldwide, if you're going to provide healthcare for your people, and if you see it as a human right, and it is a human right, and you know, a lot of us are passionate about it. I mean, it's a visceral, you know, this is what it's about. We created the National Health Service actually coming out of the war, coming out of the Second World War. It started in 1948. It was the returning warriors. It was a society fit for returning warriors. You've had some of the same thing of coming out of apartheid, haven't you? Of people saying, we're going to create a new society. And part of that's healthcare. And that's how we saw it. And that's our roots on that. And anywhere you look in the world, the biggest bulk in developed countries of expenditure comes from the public purse. Even in America, more than 50% of spend comes from tax on health. It doesn't make it sound like that. And in the poorest countries of the world, more comes out of people's pockets. So there's a shift, and I've no doubt you need to be spending more. But the trick is, how do you get some of that private sector expertise?
How did you do it in Britain, where, for instance, you levy and you tax across the board, and then some of that money goes into providing for the public healthcare system, because this is where we're not quite sure of the modalities of this national health insurance. Is how much more will the rich be taxed? How do the VATs coming through from just the consumption of the poor filter into that system? What is the role of medical aids and private healthcare providers?
Well, the first point I just make is there's an economic case for this, because actually bad health is bad for industry, and if you're thinking of the economic growth of your country, you need a healthy population, you need a healthy working population who can work right the way through their working life. So there's a really good economic case that's been made by lots of people, and your government has seen that, and I believe accepts it, that actually good healthcare is needed. In terms of particular roles, our roles are terribly simple. We just collect it from the taxpayer and then we spend it. You have a situation where you've got a transition where you've got, at the moment, I think it's something like 150 medical aid societies, I think, and some big insurers. And I would have thought there was room for a partnership, because these people, many of them anyway, and I've met, I better not name names, but I met some terrific people in your insurance companies who understand how they can use the money to change and improve healthcare, because you know, the basic healthcare is changing. You know, when I was a child, nothing that was done to me as a child in healthcare is still being done to children today. Virtually nothing, you know, I mean, some things are, but, you know, it changes fast. So actually, the insurers help make things change. And I don't know what that partnership will look like, but the most important thing is you have to build trust. And if I tell you a story about the UK, we had the government saying we don't want to work with the private sector. They were the Labour Party. They came from a left-wing background. I actually went on record as actually in something like this saying I think we should, and I got told off in public. 2 years later we changed our mind. And the private sector said we don't want to work with them. You know, we're happy doing our bit. So what we did is we brought in the South Africans. We brought in Netcare and 1 or 2 other South African companies to come in and introduce some new ways of doing healthcare. And it brought everyone to the table.
So this speaks to a lot of the work that you've done then, obviously advocating for partnerships across richer nations and poorer nations. Is it in areas like information sharing, sharing of expertise? How do partnerships work? Because, you know, right now, post this recession, and even some are saying we might even see another recession in Europe, citizens are tired. There's donor fatigue. They can't really be thinking about 0.7% of GDP going towards overseas development assistance.
Well, I think the British government, I don't speak for them, I'm an independent, but I think this government has, like the last one, is serious that by 2013 we will spend 0.7%. You know, it's going up. Everything else is going down, including healthcare expenditure is going down, but or being kept level actually, healthcare expenditure, but this is going up, so they're serious. But there's a bigger point here, which is it's not about money. Money's important, but actually it's about people. And if you know health, you'll have friends who are doctors and nurses and so on. And actually, they're interested in their work. And my friends who are doctors and nurses in the UK love to actually work with African colleagues. You know, and apart from anything else, you've got some really big problems, and actually those sort of motivate people to some extent. And so what we've been trying to do is build partnerships between people. You know, money's good, but the people's good.
Is it a partnership? Before we go to break, I'm just going to throw a curveball at you. We're told that South African universities and medical schools produce some of the best qualified doctors and nurses the world over. The world is hungry for those skills, so what ends up happening is the British want to absorb them into the NHS system. The Americans want them into their system. So we train these doctors for an international market where they are recruited, where they're paid wonderfully attractive salaries, and then we're left with a skills deficit and a poor infrastructure.
I agree with you. I campaign against this. Since 2006, it is very difficult for anyone who's a nurse or a doctor to get into the UK to work as a nurse or a doctor, because we've trained more of our own. There's much more to do. But there's a really big point here, which is that you know, that we know how to do certain things in the UK, and you can learn some of our experience. But some of the things that people are doing in Africa, without our experience and without our expertise and without our resources, are innovative, and there's an awful lot that we can learn the other way around. It's not just your health workers, but actually everyone's got something to teach and everyone's got something to learn.
Okay, we'll continue speaking on this tack. We're speaking to Lord Nigel Crisp, who's going to be talking to us about healthcare systems, partnerships between Africa and the developed world, and some of the things he likes to do when he's not talking health. He's gardening. We'll find out.